I do, and it's in keeping with what you've just said. What can you tell us about the situation at Little Mountain Place, where at least 38 people have died since an outbreak there was declared on November 22nd, and no one seems to be willing to talk about it. And it's very frustrating for many of us, where some health regions are being much more forthcoming with information about deaths. And this is a place where 38 people have died. It is the largest death toll since this pandemic has started, and no one is telling us why this happened.
Yeah, so I do know that it has been a very challenging outbreak. It's one of the ones that we know have been incredibly lethal, and one of the reasons why we have so many measures in place in long-term care and why we're focusing our vaccination on long-term care. There's no one simple thing as well about why it spreads so rapidly in some places versus others. I know Vancouver Coastal has been on site and daily and bringing in staff to support people in Little Mountain, and that it has been very challenging for them. I understand, and Vancouver Coastal and the care home are providing regular updates to family on an ongoing basis about cases, and yes, tragically, the deaths that we've seen in that care home.
Next question is from Richard Zussman, Global News.
I would also like to ask about Little Mountain and a change in policy from the province. Dr. Henry, why does the province no longer release data on case and death counts at individual long-term care facilities when it used to be provided daily? And at what point, I think the estimate is about 82% of the residents at Little Mountain have contracted COVID. At what point does the province step in to provide additional supports to that residence? You know, in Quebec and Ontario, in some cases, we saw the military step in to help in long-term care. At what point does that happen at a residence here?
Yeah, so in terms of the data, there's been no change in policy, and I have to admit this was taking me a bit by surprise, but we looked into it. Yes, we were receiving early on, when we had smaller numbers, receiving daily updates on the long-term care outbreaks. But as the numbers increase, the actual person power to get that information every day and collate it was taking hours and hours and hours of epidemiology time, because we do not have an IT system that allows us to do that efficiently. So we went to aggregate numbers, which we report on every day, and we went to still reporting the outbreaks and then the aggregate numbers, and then on a periodic basis getting the more detailed numbers. So it's not a policy change. It was merely trying to keep up with the amount of data that we were trying to collect. And we are certainly willing to provide the aggregate numbers as we get them. And I do try and present that information in our statements and on our daily briefings. In terms of when we would call in the Army, we from the very beginning have had a very aggressive plan to support outbreak response in long-term care homes. And we do it by having teams with public health leadership, with administrative leadership, because that is often a really important part of organizing to manage an outbreak, making sure that we do testing, and this is one of the places we use our rapid tests. As soon as a person in a long-term care home is ill, the rapid tests help us identify right away whether it's influenza or COVID, and we do testing of everybody in the facility, both residents and staff, depending on movement of staff. It may be the whole staff or maybe just people in a certain unit, but we use the rapid test, for example, to do that on an ongoing basis during the pandemic, during an outbreak. As well, we test everybody, whether they're symptomatic or asymptomatic. And we also have been training staff to come in to support long-term care homes. Because as you say, when large numbers of residents are affected and staff are affected, that can mean staffing shortages. So we have not had to rely on staff from the military or other places, because we have a pool of people who are part of the teams that go into the long-term care homes when we have outbreaks. And that has worked so far, and some outbreaks have been very, very challenging, and two of them that were finally over today, Finnish House and Three Links, were also ones that were incredibly challenging. We know Jubilee in the north and Invermere in the interior. You know, we don't always know the reason why it seems to spread so quickly in some facilities versus others. We try very much to make sure the staffing is maintained, that personal protective equipment is there, and we did that very early for all of our care homes, that the cleaning processes are in place. We have infection control teams that work with the homes, and sometimes it's just an incredible challenge, and I wish we knew the answers to how it was being transmitted in some cases.
It has refused to answer any questions. They passed our request back to Vancouver Coastal Health, who in turn has told families to go back to the care home for answers. So who's ultimately accountable for the response? Will these outbreaks be investigated? And why hasn't staff capacity been increased so that staff can be properly cohorted to work on only one floor?
Okay, so some of those details, I can tell you staffing has been increased, and they've been, Vancouver Coastal staff have supplemented when there have been staff off, and so that may be why people are seeing new faces in some places, for example. You know, cohorting depends on where we're seeing the virus and how it's spreading, so that is something that's an operational piece that the team on the ground will determine as they manage the outbreak, so it varies from time to time. The ultimate responsibility absolutely is with the care home, but it's a partnership with us in public health. And we, the teams in Vancouver Coastal work with the care home. The ultimate authority in terms of directing what happens in the outbreak response is the medical health officer from Vancouver Coastal, in this case, who has the ability to direct the outbreak response. And yes, I don't know the details of why. My understanding is that there is regular information going from Vancouver Coastal to families, and that they are kept up to date on a regular basis about what's happening in that care home.